dear colleagues. My name is Anastasia Lapshyna. I'm aesthetic doctor. I work with in aesthetics laboratory for more than 10 years. And today we are going to discuss with you really very interesting topic because we are going to talk about brand MELINE. I'm sure that there are a lot of doctors who are already familiar with this brand. That's for sure. All over the world, there are a lot of really very good results after using of these products. So today we are going to discuss the main peculiarities, the main advantages, how to use that to obtain really best results with the patients. And first of all, I would like to explain, let's say, what is the difference of brand MELINE, because it's really unique. And the main, let's say, advantage of this brand is that here you can find really differentiative approach to different kinds of hyperpigmentation. So here there would be products for different types of hyperpigmentations, like melanin type or melanocyte type of hyperpigmentation. For different areas, there is peeling for periorbital area, for intimate area, for the face in the case of melasma. And also here you have products for different phototypes. So depending on what kind of patients do you have, you can work or with the products for 1, 2, 3 phototype, or with the products for 6 phototypes, which is really great because you have the opportunity to be really very, very precise and differentiative in the case of different kinds of hyperpigmentation. So the next advantage of the product, and in order to understand why it's so effective, you can pay attention to the active ingredients. All the formulations were made to influence all the steps of melanogenesis. So in every product, you have ingredients which will slow down or inhibit melanogenesis before synthesis of melanin, just before it started, like peptides, for example, during the synthesis of melanin, and also after synthesis of melanin, when we already have hyperpigmented keratinocytes. So we also have ingredients in order to remove them. That is why you can see also all the ingredients in these presentations, they are marked with these colors. So it also will help you to understand which ingredient on which step of melanogenesis will work and will inhibit melanogenesis. MELINE is a system. So we can't say that this is just peeling that we are doing professionally, or then there is just a home treatment which we are doing. Treatment of melasma or of different kinds of hyperpigmentation is always a system. It's impossible to treat hyperpigmentation without, for example, proper regeneration of the skin or inhibition of the activation of the melanocytes after professional treatment, because even if we are doing really effective professional treatments, peelings, lasers, whatever, always this would be an aggression towards the skin. So always this would be the stimulation of the activation of the melanocytes after such kind of treatments. That is why it is crucial to have the second step, to have the home treatment after professional treatment in order to have really good results. Then, of course, we have to take care about the sun protection. It's impossible to treat hyperpigmentation without using filters. We have to take care about the basal membrane, because if there are any gaps, interruptions, and so on, this is always the risk of the dermal hyperpigmentation, which is almost impossible to treat or very difficult to treat. So actually, MELINE is the system which covers all these steps. It's very easy to understand which product for which treatment you need, because first of all of the products, you will see it on all the packages, you will see red line or gray line. Red line means that this is a professional treatment which you are going to use in clinic, and gray line, it means that this is the product which you're gonna recommend your patient to use at home. This is like the second step of the treatment. Also, on all the packages, you will see numbers like 00 up to 05. So 00 is the product for the preparation of the skin before the treatment. That we will use just in the case of the melasma treatment for face with two products, ethnic skin and Caucasian skin. Then all the professional treatments will be marked with 01. So that would be your professional peelings, that would be product for the mesotherapy or intradermal use. That would be products that we are going to use for the finishing of the treatment, like moist or restore. 02, already you can see that 02, 3, 4, and 5 are the products marked with the gray line. So these 02 would be the second step of the treatment. It would be the products based on the acids, and they are also very specific. So every peeling would have its own 02 depending on the area, depending on the phototype with which we are working. 03 would be the products for the regeneration and restoration of the skin after the treatment based on hyaluronic acid or some smoothing ingredients I will show you later. But 03 actually would be the same products that we are using during the professional treatment to finish the treatment, but here you will have the smaller amount, like the smaller volumes of the products. 04 would be BB creams, light and medium, with SPF 30 in order to protect the skin. And 05 is the product which you are going to use in the cases of severe hyperpigmentation in order to maintain the results which you've already obtained in clinic. So now we are going to discuss all the products, their composition, how to use it. And first of all, of course, we start with the cleansing of the face. For the cleansing of the face, there is MELINE Gentle Foam, which is really very, very soft cleanser. So if you will pay attention to the active ingredients that we have here in this foam, this is dexpanthenol, this is bisabolol, also some organic anions and minerals like magnesium, copper, zinc. You can see that this is really a great moisturizing product. This is also a great product for sensitive skin. I use it not only in the cases of treatment of patients with the hyperpigmentations or recommending that only in the cases of hyperpigmentation. This is also my favorite product in the case of really sensitive skin when patients need something very gentle, not to dry the skin. So gentle foam, I'm sure that you will like it, your patients will like it, and you will see that the quality of skin is completely different. So this gentle foam is recommended before any professional treatment, and also you recommend it to your patient to use at home, because when we are talking about skin with hyperpigmentation, this is always damaged skin. So we have to be really very, very careful and gentle during the treatment or during the home care with such kind of skin. So let's start with the treatment of melasma. So this is usually the problem or cosmetological issue which is associated with the hormonal disbalance. So that is why usually it starts during the period of pregnancy, during the period of lactation, menopause period, or during the intake of oral contraceptives. So also, I'm sure you know that melasma it's very characteristic for melasma to have spots in the cheeks, in the forehead, and they are usually symmetrical spots. So in this case, we have to work with the face and with the whole area of the face. So here is important to not inactivate, but slow down the activity of melanocytes, slow down melanogenesis, and usually we have this effect by decreasing the activity of tyrosinase, which is the enzyme responsible for the transformation of the amino acid tyrosine into eumelanin or phenylalanine. So talking about treatment of melasma, we will have two options depending on the phototype. The first option would be Caucasian skin in the case if you are treating first, second, and third phototype by Fitzpatrick. And that would be ethnic skin in the case when we are treating 4, 5, and 6 phototypes by Fitzpatrick. Before that treatments that I'm gonna explain you the protocols, how we are gonna do that, we have to prepare the skin. So for that we have 00 prep, which is the solution for the repolarizing of the skin. And actually this is the preparation of the skin. So here pay attention to the active ingredients of 00 prep. You will see that it's really very gentle. Here we have lactobionic acid, lactic, ferulic acid, thiotic acid, and already here we have nonapeptide 1, or the other name of this peptide is melanostatin 5. So it means that just with this product, we already will start to inhibit melanogenesis even before we'll start the synthesis of pigment. So this nonapeptide 1 is the peptide which is very, very similar by its structure with the hormones which are responsible for the stimulation of the synthesis of pigment. So this peptide will sit on the receptor, on the melanocortin receptors, which are located on the melanocytes, and in that way hormones, melanostimulating hormones, will not be able to sit on that receptors. So this is how we can influence the process of melanogenesis even before it starts. And also the other active ingredients are mentioned with different colors, and here you can see in what step of melanogenesis we really influence, like pre-synthesis, post-synthesis, or during the synthesis of melanogenesis. This product we will use just before Caucasian skin or ethnic skin. For the other treatments, we will not use it. So let's see the whole protocol of the products, starting with the treatment of melasma with Caucasian skin. So we will use it for 1 to 3 phototypes. For this treatment, we have professional peeling, chemical peel 01 Caucasian skin, which you can see here with the red line, which means that you will use it in the clinic. And also we have products for the home treatment. I even cannot say that it's home care. This is really home treatment. That is the second step of the professional treatment. We have 02 Caucasian skin day and 02 Caucasian skin night with already gray line on it. So the active ingredients that we will have in 01 Caucasian skin would be azelaic acid, tranexamic acid, arbutin, coic acid, retinol, and resorcinol. So again, by the colors, you can see that we will influence different steps of melanogenesis. We will inhibit tyrosinase, we will inhibit plasminogen, we will also induce the cell turnover in order to remove the hyperpigmented cells. So actually, this is very effective treatment in the case when you already have, doesn't matter, superficial hyperpigmentation, or in the most of cases we are working with the mixed hyperpigmentation when the pigment is located in both epidermal and dermal layers. So for that reason we are using this product, and I will also show you the protocol which we are using. What is crucial? It's crucial to understand that after this professional treatment, we have to recommend patients to use home treatment. I know that sometimes it's really difficult to explain to patients that this is important, but we have to do that because treatment at home is like 75% of success. If we are doing any professional treatment in the case of hyperpigmentation, and after that we are not using home treatment, then we will never get really stable results. We will never get really good results, because actually every treatment that we are doing is some kind of trigger for melanocyte. So peeling, for example, is a burn. It's controlled, but that's a burn. So our melanocytes in some time they will be activated and they will start to produce more pigment. This is actually the reason why we have so many patients who are coming after a lot of years of treatment hyperpigmentation without having really very good results. Because everyone wants to have results very quickly, not to have any home treatment, not to protect the skin, not to regenerate the skin, and so on. In the case, especially in the case of hyperpigmentation, it's crucial to have home treatment. I'm usually saying that if I see, after all my explanation, that the patient doesn't want to have both professional and home treatment, they want to have just only peelings, they want to have lasers, and so on, and I'm not sure will they really use their home treatment. So usually I try to explain that it's better actually to do vice versa, not to do professional treatments, but step by step to use home treatment slowly, but really to get good results and to be completely safe. So in this case, we are not triggering the melanocyte really so significantly as we are doing by professional treatment. So we don't have any risks of complications. And slowly, step by step, we are inhibiting melanogenesis. We are getting rid of the hyperpigmentation which already exists. And for sure, your patient will see very good results. But in this case, when you are skipping professional treatment, they will have these results in a longer time than with the professional treatment. But that is better than just to do peeling and not to use any professional treatment. Also, as you can see here, like Caucasian Skin Day and Caucasian Skin Night also have different ingredients which are influence all the steps of melanogenesis. We are obtaining some kind of anti-inflammatory effect. We are blocking the system of transformation of the tyrosinase. This is really a great antioxidant effect. Also pay attention to the active ingredients of the Caucasian Skin Night, where we have again nonapeptide 1, azelaic acid, retinol. So it's like a common question when professionals or patients ask if it's possible not to use day serum, just to use night, not to use night, just to use day. So here you have to understand that the principle of effect of mechanism of action of those two products is different. We are using Caucasian Skin Day for the getting rid of the hyperpigmentation and for the lightening effect towards the pigmentation which patients already have. And we are using Caucasian Skin Night in order to prevent hyperpigmentation in future, because here we have nonapeptide 1 or melanostatin 5. This is completely different mechanism of action. That is why when you are not using one of them, you are like skipping half of the effect. You're skipping half of the inhibition of the process of melanogenesis. Also, all the clinical trials which were conducted with MELINE, which we are sharing with you when we want to show really the efficacy of the brand, it was conducted with a full system. When we are performing minimum 3 sessions of MELINE, and then the patient uses 0-2 Caucasian Skin Day and Night minimum for 2 months. So in that case, we can guarantee really great results using these products. So that is also something important to explain to the patient, why we insist on using of the home treatment after professional treatment. Okay, now let's see the protocol of treatment, which is really, I guess, one of the most important questions in the understanding of the product, because depending on the time of exposure, you will get really different results. So first of all, when we have the patient, we will cleanse the skin with the MELINE gentle foam, and then we degrease the skin. This is the first important step. So don't confuse degreasing the skin with the using of MELINE 00 prep. It's two different steps. Degreasing of the skin is the step that we need before any peeling, because during the steps we are removing the sebum from the superficial layers of the skin. So in this way, we give the opportunity to the peeling to penetrate and not to be neutralized in the superficial layers of the skin with the help of the sebum. That's why it's very important. Then we are using MELINE 00 prep, and that we are using in order to low down the pH of the skin. So in this way, we are preparing the skin for the peeling. Because when we are first using something gentle, our keratinocytes will not send the signals of like a significant burn. That's why the peeling that we will use after 00 prep, it will be accepted in a more mild way by the skin. That's why we are using 00 prep, and also in 00 prep you already have peptide which will inhibit the or block the possibility of the interaction of melanostimulating hormone with the melanocytes. How usually we use PrEP? So I would recommend you to use it in several layers. You can use it with cotton swab, you can use it with a fan brush, and depending on the reaction of the skin, I will also show you the video with the treatment, you will use from 1 to 3 layers. After that, you don't wash it off, you just apply MELINE 01 Caucasian skin, which is actually like the yellowish emulsion. So it's not a cream, it's not totally liquid, it's like really emulsion. You apply also around 2-3 grams of the product, so not a thick layer, with the help of the fan brush or with the hands and gloves. And then it's important the time of exposure. The classic one would be between 30 to 45 minutes, or also I would say between 30 minutes to 1 hour. That is the average time of exposure. If you are working with the peeling for the first time, then you can start with 30 minutes. When you already will have some experience, you will see different reactions of the skin. You can start with 45 minutes and then go up to 1 hour. This is the average time, which is on label. And during this time, never you will get any kind of side effects. So it will work, it will give you very predictable results, it will be very effective, and really you will see the results even of changing the quality of skin even in one treatment. So when you apply 01 Caucasian skin, in 15 minutes you can apply the second layer in the problematic areas. Also, I like to do something like massage in order to stimulate the penetration. And after time of exposure, so after 30 or 45 minutes or 1 hour, you have to wash it off with MELINE Gentle Foam and finish the treatment with MELINE Moist or Restore, or both of them. I will also explain you what is the difference between these products and how we recommend you to use them. So here is the protocol of treatment. Why video is not working? Okay. So first we cleanse the skin with the gentle foam. Then we degrease the skin with the help of the degreasing solution of anesthetics. So degreasing is really a very important step. We always pay your attention to the degreasing, that you shouldn't skip it. And also have to do it thoroughly. So especially if the patient have some oily skin with a hyperkeratosis, you have to do it really thoroughly, not just touch the skin with degreasing solution. So after degreasing, I'm using 00 prep with 2 cotton swabs, or you can do it with a brush, no problem. And here, everything would depend on the reaction of the skin. As you can see here, this patient really, we are doing a lot of peelings, we are doing a lot of treatments for her, so she doesn't have sensitive skin, the skin is prepared. That is why during the application, she doesn't feel any discomfortable, uh, anything that would be discomfortable for her. I don't see any reaction like redness. The skin is not damaged, like we don't see any spots or areas of frosting, because if there would be really damaged skin, then you can see some spots superficially. That means that for that patient, 1 layer of 00 prep would be enough. But mostly it would be very comfortable for the patient. So in this case, I use several layers, like up to 3 layers. As I've already mentioned, you don't have to wash it off. You just wait a couple of minutes to dry, and after that we are using 01 Caucasian skin. You can apply 01 with the brush. It can be bigger than that. I wouldn't say that this is the best brush for the application, but still, that can be any brush which you prefer, or even you can apply it with hands with massage movements. As you can see, you don't use thick layer. Just applying that evenly on the whole face, except periorbital area, because we have a specific product to work in the periorbital area. That would be dark circles. We will discuss it later. Also, I'm always saying that if you have Caucasian skin in your clinic, you won't work just with the hyperpigmentation with this product. That's for sure, because you saw active ingredients. So you could see that there are a lot of anti-inflammatory ingredients. That's why for the patients with acne lesions, for the patients with acne, you will get really very good results with Caucasian skin. Also working, like you will see that the quality of skin is much better because you also have retinoids in this peeling, you have retinoids in the home treatment. That is why the quality of skin will be much better, and you also will use this product like anti-aging product. During the application of this peeling, usually it's very comfortable for the patient. So they will say that maybe they feel a bit of some warmth sensation, maybe some kind of burning sensation, but just for a couple of minutes. And then in 2-3 minutes, they feel totally comfortable. And during all the time of exposure, they don't feel anything. So that's okay. As you can see here, you don't have any kind of irritation or erythema. So just to stimulate the penetration of peeling, to activate it, you are using some massage movements. And that's all. So with this patient, we had time of exposure 1 hour. In 1 hour, I'm cleansing peeling, I'm cleansing face with gentle foam. During the process of cleansing of peeling, patients can say that they feel some kind of burning. That's also okay, because when we have peeling which is applied on the skin, of course, the pH of the skin is very low. And then we we have a contact with water and cleanser. So the difference of pH, of course, will cause some kind of burning sensations, and that's okay. But that would be, again, just for a couple of minutes, and then patient will feel comfortable. Also, as you can see here, we don't have redness, we don't have irritation. In using this peeling, you will never get frosting, so it will never give you frosting, even if you will use it off-label. And just don't want to give you protocols off-label with a very long terms of exposure, let's say for several hours, because for start, I wouldn't recommend you. So you have to start to work with the product, you have to understand it, to see different reactions and so on. But you have to know that there are some off-label protocols that we are usually discussing in our offline trainings. After moisturizing after cleansing the face, we have to moisturize it and we have to finish the treatment. So for that, we are using two products, MELINE Restore and MELINE Moist. If you want to use both of this product, because they are different, first you use Restore, because Restore has creamy structure, and Restore has the ingredients which will penetrate deeply, like more deep than Moist. Moist contains hyaluronic acid in high concentration, so this hyaluronic acid will stay more superficially, and it will be like the occlusion for the skin, so it will prevent transepidermal water loss. And we finish the treatment with 04BB cream. Patients usually love it. I recommend you to have BB creams in your clinic to finish the treatment with them, because they are like half transparent, they don't have the effect of the mask, they are really very pleasant for the skin, because it's not just the sun protection, it's also the improvement of quality of skin. I will later show you the active ingredients, and that's why patients really prefer to use it after professional treatments, even without any kind of professional treatments, like their makeup, because it's both makeup and skincare and also sun protection. So at home, patient will start to use 02 Caucasian Skin Day and Night, and also 03 Restore and Moist. Also, I would like to explain you how we are gonna use 02 day and night. This is important. So when you did professional treatment, what effect we are expecting? By the end of the second day, the exfoliation will start. It will be like average exfoliation, starting from the middle part of the face, which is mimically active, and then going to the lateral parts of the face. It will last around 5 days, and usually the most active that would be third, 4 days, and then it will be lower and lower. I'm not recommended to start to use 02 day or night just the next day after professional treatment. I usually recommend to wait for 4 or 5 days up to 7 days, depending on the reaction of the skin. Because if you was doing the treatment during just 30 minutes, then it's okay. Then the regeneration will be much faster. There would not be significant exfoliation or something like that. So you can start to use 02, let's say, on the third, fourth day. But in the most of the cases, when you are using the peeling, the time of exposure, like 45 minutes, 1 hour, then for the total regeneration of the skin, for after the the effect of the exfoliation, you need around 5-7 days. So in these 5-7 days, after these 5-7 days, you're recommending your patient to start to use 02 Caucasian skin day and night. I can say that most of the patient cannot use this product every day, because you saw the active ingredients, you saw that also the concentrations of the acids inside, and we understand that using every day, every night, 02 Caucasian skin would cause some kind of irritation, some kind of exfoliation, especially if the skin of the patient is sensitive or damaged. That's why I recommend to use it not every day. So we start to use it like 3 times a week. For example, we are using that Monday, Thursday, and Sunday. And then we evaluate the situation. So you ask the patient if it's comfortable, if there is no significant irritation, because sometimes they can say that I usually feel really warmth. My skin is usually red, and then I notice that it's always flaky. I have exfoliation. So then you have to reduce the using of the products. You have to go to 2 times a week, for example. And then step by step, maybe in 2 weeks, maybe in 3 weeks, you will go up to 3 times a week. So you have to evaluate the reaction of the skin, and you have to find really comfortable regimen. But at the same time, of course, we understand that these are the active products. So it's okay if it causes some kind of redness, but not very long lasting, because these are acids, and this is actually the treatment of the hyperpigmentation. And 02 your patients will use minimum for 2 months. Then you will evaluate. So if it's enough, if you really have good results of the treatment, then you can switch to more, let's say, mild products, like we have Inner Epigen Pigment Defense Serum, which also contains active ingredients, but it's more mild than 02 Caucasian skin. Sometimes some of the patients, they stay with 02 Caucasian skin all year round, but they are using that just once a week, for example, so that they used it like an active phase was 2 months. And then they're using Caucasian skin night, for example, just for the prevention of the hyperpigmentation, just once a week. Also, I'm sure your patients will love 02 Caucasian skin night, because it gives really improvement of the quality of skin. Because here we have retinol, so the skin will be, let's say, more matte. The wrinkles will be less significant. The depth of the wrinkles will be also less. So it's really great product, which patients usually love. That's why it's also possible to use it all year round, even in the case of sun. But we have to understand that, of course, during such kind of treatment, and in any case of treatment of hyperpigmentation, we need sun protection. That is something that we have to explain to the patients. So that was Caucasian skin. Here you can see the results of the clinical trials, which were conducted with Caucasian skin after 3 sessions and 2 months of use of 02 Caucasian skin day and night. You can see really significant improvement, not only in the when we are discussing hyperpigmentation, also in the quality of skin is much better. So ethnic skin would be the line of the products. Like the idea would be, let's say, the same as Caucasian skin. The difference is that ethnic skin are the products which we are using in the case of treatment of melasma and chloasma, but for the patient with phototypes 4, 5, 6. So here we have 01 ethnic skin professional peel, and also 02 ethnic skin day and night. So again, all the active ingredients, they will cause different, like I want to show you that we have active ingredients that will influence different steps of melanogenesis. Again, the only difference with ethnic skin is that, of course, here we have more gentle solutions, because you know that it's much more difficult to work with the dark phototypes, not to have any side effects after peelings. So here all the effect will be mostly based on the anti-inflammatory properties of the active ingredients and also on the antioxidant properties of the active ingredients, which you will see here. The same will happen with the ethnic skin day and night. So here would be more mild active ingredients like just 2% of salicylic acid, 2% of the phenylalanine, which we need in order to stimulate the synthesis of not the dark pigment, but more light pigment, which is phenylalanine. We have glutathione, which is one of the most effective and active antioxidants that we work with. And with the ethnic skin night, this is also for the prevention of the hyperpigmentation in future. So here we have melanostatin 5 peptide, which is reducing or blocking the possibility of the hormones to connect with the receptors of the melanocytes, and antioxidants and also anti-inflammatory ingredients like mandelic acid, for example. As for the protocol of treatment, that would be all the same recommendations as I've already mentioned for you in the case of Caucasian skin. The only difference, I would recommend you not to change the time of exposure. So here it would be like from 30 minutes to 45 minutes. That would be enough for the patient with the dark phototypes not to have any risk of any side effects after the treatment. So here we usually do one treatment for the first treatment during the 30 minutes, and then we will do treatments up to 45 minutes. As for the quantity of treatments, in the case of both Caucasian and ethnic skin, I would say that the average quantity would be from 3 to 4 sessions. Of course, everything depends on the severity of the hyperpigmentation and of melasma. The interval between the treatments. So in the classic protocol, you can see that it can be 1 month. And I would say that with the dark phototypes, 1 month, I usually prefer really 3 weeks for the ethnic skin. So during these 3 weeks, patient is using home treatment 0-2, home care 0-3 in order to regenerate the skin, to moisturize the skin, protect the skin, and then in 3 weeks we are doing the next session. In the case of Caucasian skin, I can do it even every 2 weeks. So especially when I'm working with really severe hyperpigmentation, I know that I will need like 4 sessions or maybe 5 sessions. I will not do it during 5 months. So I will have the interval between the sessions like 2, max 3 weeks. And I will do it a bit faster, and then I will continue the treatment just with the home treatment based on the 0-2 professional products. Here you can see really great results with the ethnic skin. Pay attention also to the quality of skin. It's completely different. Of course, the severity of pigmentation, the deposit of pigment are much less. And the quality of skin, you really can see it even after the first treatment. Patients really love the skin, like some lifting effect, more tightened skin. And remember, I was telling that you will get really great result also in the case of acne lesions. So those patients who have oily skin, who have some acne lesions, skin prone to acne, they will also love it because the skin will look completely different. The active ingredients, they're like regulating all these processes in the skin. So these were 2 main products which we are using for treatment of melasma and chloasma. Now let's discuss the other products which we have for treatment of different kinds of hyperpigmentation. And 01 ID is like another option to treat melasma. So 01 ID is the professional treatment for transdermal delivery. This is the transdermal delivery solution, which you already can use with microneedling, which you can use with mesotherapy, for example, which you can use just topically, but after some treatments like microneedling radiofrequency after, not together with, but just after the treatment or after laser treatment, you can use that. So in the case of MELINE ID, we have tranexamic acid, glutathione, niacinamide, ascorbic acid. So mainly this is the product which is based on very active antioxidants and inhibitors of melanogenesis. The advantage of this product is that you can use it really completely safe during all year round. So if you need to work with the patient, in the case if you're working really during the season of the active sun, or you are not sure about your patient's responsibility, if he will use sun protection and so on, 01 ID is really safe option because it doesn't have it doesn't increase sensitivity like it does in the case of peelings. That is why you can use it. Also, this is the great product to prepare the skin for any kind of other treatments, because here you already have active antioxidants. You already will inhibit inflammation and prevent any kind of side effects or complication, which you can obtain with very aggressive treatments like lasers, for example. I like to combine 01 ID with Caucasian or ethnic skin, not in one session, but between the sessions. What's the difference? So, you know that it's crucial to understand the depths of the hyperpigmentation, where we have the pigment. Is it in the epidermal layers or is it in the dermal layers? And mostly we are working with a patient with a mixed hyperpigmentation. So it's not located just in the epidermis or only in the dermis. We have it in different layers. You also can see it even during like while treatment. It usually doesn't happen like all the spot is getting lighter and lighter and disappears. No, you can see that the spot is changes, that there are some more light spots inside, there are more dark spots inside, the borders of the spot are not even, and so on. So it means that you reduce the pigment which is located superficially, but it's very difficult to get deep down to work with the dermal hyperpigmentation. That is why with Caucasian or ethnic skin, we are working mostly with the superficial layers. And to work with the dermal hyperpigmentation, I work 01 ID because with the help of microneedling or with the help of mesotherapy, just with the needle, I can insert this product just into the targeted area, just into the layer I want to affect, so inside the dermis, actually. That's why such kind of combination, I really recommend you. The product is very effective. It gives glowing effect. It's also a great prevention of aging because of the antioxidant activity. It's preparation the skin for some kind of aggressive treatment, and that's the great combination with the peelings. So to perform the treatment, we need to cleanse the skin. Then, of course, we disinfect the skin and we apply 1 ampule. So it's not recommended to apply less than 1 ampule. Even if you have spot just in the cheek area or just in the frontal area, then use it for the whole face, because we need a certain dosage of the product in order to get good results. And also we have to work with the whole surface of the face. We are not working just with the separate areas, because you will see that the skin is really different. The quality is much better. So you apply it with any transdermal delivery system. That could be microneedling, that could be dermapen, any kind of microneedling. Let's say I also use it with just mesotherapy techniques. Everything depends on the regulations in your country. And after I'm not cleansing, I'm just using some product for disinfection like chlorhexidine, and I'm finishing the treatment with moist and restore. You need 1 week interval between sessions of MELINE ID. In the case of other types of hyperpigmentations like solar lentigos, what we are going to do. So you know that solar lentigos differs greatly from melasma because solar lentigens are usually small pigmented spots with a diameter around 0.5 to 1 centimeter located in the areas which are prone to sun exposure. So mostly that would be face, shoulders, back, and hands. And almost always that would be dermal hyperpigmentation because of the sun exposure. So in this case, we have to work in the different way. Actually, there is no much sense to use inhibitors of the tyrosinase because this is the long treatment and we are working with a very small area. Here, it's much more better to influence the melanocytes, which are producing more pigment in this area to damage some melanocytes just in this area. So we cannot damage melanocytes all over the face when we are working with melasma. But when you're working with the small spots, we can do that, like 1 square centimeter. So here we have, again, professional peeling, which is 0-1 spots. It will consist of 2 steps. And we have product for home use 0-2 spots, which patients will use after professional treatment. So active ingredients of 0-1 spots in the first step, which is the liquid solution that we have in a vial, we will have azelaic acid, tranexamic acid, and resorcinol. Step 2 is like the violet pasta. So here we have salicylic and pyruvic acid, and we will apply it after. So I would like to show you the protocol of treatment. This is the home care product, which patient will start to use after professional treatment. It's very comfortable to use because it's a roller that you can apply all the active ingredients, and patients will use it every day, 2 times a day. Again, this is like the second step of treatment. We have the active ingredients influencing different steps of melanogenesis. So the treatment is very fast and very easy. We just need to cleanse the area of the treatment. Then we use again degreasing solution. For the degreasing, in this case, I try to traumatize the skin mechanically a bit. So for the degreasing, I use gauze. And I degrease the skin even like while I need to obtain some kind of redness. So you really have mechanical trauma. Because you need to get frosting with the step 1. That's why I use for between 0.1 to 0.5 milliliters of step 1 of 0.1 spots with the cotton swab. And you can use it up to 3 layers. So your goal is to have frosting. If you obtain white frosting just from the first layer, then that's fine. Maybe the skin is very thin, maybe it's very fragile or damaged, then 1 layer is enough. If you don't get frosting from the first layer, from the second layer, you need to apply 3rd layer. So you need to be really deep in order to have frosting effect, in order to damage some melanocytes in the area that we are working with the lentigo. After you obtained frosting, you have to apply step 2, which is like pasta consistence, and you apply really a thick layer. You are doing like an application, and then you can apply, for example, transparent film or aid band for the occlusion for 1 hour up to 1.5 hours. So patient will go home, and at home patient will wash it off and use products for moisturizing like Moist or Restore. And around in 4 days, patient will start to use 02 spots. So here you can see the protocol of treatment of the lentigo. This is after cleansing, after degreasing, we already apply 01 first step. So it's not very clear on the video, but already after the first layer, you will see that it's becoming like grayish, more white. So you are applying the second layer. There are already white spots of frosting. And we are applying the second step. You see, like a thick layer. You can do it, by the way, just with a spatula or with a finger with gloves, not to lose any product in the cotton, as you can see here. Then you need occlusion, and usually your patient just go home, and at home they will remove the occlusion and they will cleanse their face. So it's like 15 minutes treatment. Here you can see really significant improvement of this patient. But for example, in this case, I would recommend to do the second session in 1 month. And mostly you will need from 1 to 2 sessions, not more. So you will have really good results after this treatment. For example, in this case, I think that first of all, the frosting was obtained. Maybe there were much more layers. I don't know, because usually I'm not getting crusts like this, but it's also possible. And as you can see, after removing, it should not be removed by the patients. It's very important. You have to explain that. But after it will be removed by itself, you can see that the skin is really depigmented here. Sometimes you can see that the skin is even more light, like other areas, more light. That's okay. That can be for several months because you are damaging the melanocytes in this area. So you're getting frosting, and that's fine. So that's why to protect this area, patient will have to use some products like Restore to moisturize the skin, to stimulate the regeneration of the skin, and of course, sun protection. So after it will be removed, patient will start also to use 02. You understand that there is no, let's say, sense to use serum up to this crust. But if your patient have just light exfoliation, not something like this, then it's okay to use 02 during this exfoliation. So usually that would be 3rd day after peeling. If you need to repeat peeling, that would be in 1 month, because the treatment is associated with let's say, trauma, with frosting, with damaging melanocytes. So we don't recommend to do it more often. But the results, like 1-2 sessions, and that would be enough. You will not need more sessions for your clients. The next area and next feeling that we are going to discuss would be dark circles. So this is the specific product for the treatment of periocular hyperpigmentation. You know that this area is very specific, is very delicate, very gentle, so it's not possible to use the same products that we are using for the face. That's why in this case we have really very delicate product, but at the same time very effective, and that would be dark circles. It consists of two steps. First step contains monofluoroacetic acid and lactic acid. Monofluoroacetic acid is the modification of trifluoroacetic acid. So it would be as effective as trifluoroacetic, but at the same time, it would be not so aggressive. So it's very gentle because due to the modification, there are less of atoms of chlorine in the molecule of the fluoroacetic acid. And lactic acid we need for the hydration and also lightening effect of the periorbital area. Step 2 will contain retinol, ascorbic acid, and phytic acid. So mostly the ingredients that we need just for the lightening effect. After the treatment, patient will start to use 0 to dark circles. And this is the product which I would like to pay your attention at. I really love this product, even without professional treatment. I like it for patients in the case of melanin hyperpigmentation. So if in the periorbital area we have really brownish hyperpigmentation, but also you can use it in the case of dark circles like bluish. So in the case when you want to stimulate or improve microcirculation, when you want to improve or strengthen the walls of the capillaries in this area. And even I recommend to use it for the patients after plastic surgery. So those patients who had rhinoplastics, for example, usually after such kind of surgeries, they have bruises around the eyes for a long period. After these bruises, they have another type of hyperpigmentation. It's not melanin type. It's, as you know, there is a specific pigment in the blood, in the hemoglobin. So this pigment is called hemosiderin. And this hyperpigmentation can be associated with the hemosiderin because the bruises staying for the long time around the eyes. So for that patients, that would be also really great product to use to lighten the skin. So what would be the protocol of treatment? First of all, we can apply it in both upper and lower eyelid. As for the moving eyelid, you also can use it, but like carefully with less quantity of layers, because moving part of the upper eyelid is very thin skin. So here it's very easy to get some swelling. That's why if needed, you can do it, but just you have to discuss it with the patient and to explain that it's possible that they will get some kind of swelling. So of course we cleanse the skin. You can degrease, but it's not very important. In the periorbital area, the skin is usually dry. There are a lot of sebaceous glands. That is why it's okay if you will even not degrease skin around the eyes. So then we are using step 1 in several layers, like 2 or 3 layers of step 1, which you are applying with the cotton swab. And after that, we are applying step 2 in 1 or 2 layers. And the last layer of step 2, you can leave up to 15 minutes. So everything will depend on the reaction of the skin. If you can see that the skin is very reactive, very sensitive, and just after the application of the first or second layer of the step 1, or after the application of the first layer of step 2, patient has some burning, some redness, then we understand that we don't need to use more layers. We don't need to apply more layers, and we don't need to wait up to 15 minutes. We will cleanse the skin just in a couple of minutes, in 2-3 minutes, and vice versa. If patient doesn't have any irritation, doesn't feel almost everything, up to 3 layers of the first step, 2 layers of the second step, then it's okay to use the peeling to apply during 15 minutes. So after the time of exposure, we wash it off with the MELINE Gentle Foam and finish with MELINE Moist and Restore. It is recommended 4 sessions with 2 weeks interval. So here you can see the protocol of treatment. First of all, we cleanse the skin with gentle foam. You also can combine this peeling with any other peeling for the other areas of the face. So you can do, for example, Caucasian or ethnic skin for the face, and in the periorbital area, you will use dark spot. Here I use just a bit of degreasing solution for the upper and lower eyelid. Then we use 0,1, the first step of dark circles, and apply it with a cotton swab. You also can protect the eyebrow area with some cream if there is a tattoo makeup, for example. But of course, this is a gentle peel, so like it's not easy to remove, because we understand that tattoo makeup, that's the dermal deep pigmentation. It wouldn't be so easy to remove it with the peeling. So in the case of the first step, we just wait a couple of minutes to dry, and then we are applying the second step. So second step, the quantity of the layers will depend on the reaction of the skin. And with the last layer, we will wait from 2 to 15 minutes, again, depending on the reaction. Okay, after washing off, we finish the treatment with Restore and Moist, cream and serum for the regeneration of the skin. So in 2 weeks, we will do the next session. And 0,2, your patient will start to use depending on the rehabilitation of the skin. So for those patients who, like here, you don't see any irritation, you don't see any redness of the skin, reaction of the skin, she can start to use 0,2, for example, in 2 days after treatment. In the case when your patient have redness, some exfoliation around in the periorbital area, then wait for the total regeneration of the skin and start to use 0,2 around in a week. So again, we use, of course, sun protection 0,4 BB and recommend home treatment. So here you can see really good results of the lightening in the periorbital area using dark circles, both professional and home treatment. And the last professional product would be Intimate, which we are using for the lightening in the intimate areas. That can be intimate areas, inner side of the hips, armpits, or in the area under breast, for example. So all these areas which are prone to hyperpigmentation can be treated with an Intimate, which is really very delicate product. And also for home care, to maintain the result and also to have like the second step of the professional treatment, we have 02 Intimate. Oh, sorry. So here you can see the active ingredients of 01 Intimate, which are mandelic acid, tranexamic acid, salicylic acid, lactobionic, and retinol. So very, very gentle active ingredients, but at the same time, this is really very effective anti-inflammatory and a bit of keratolytic effect. And for the home care, again, we have 02 Intimate like a roller. So that would be the prevention of the hyperpigmentation in future, and that would be the product that patient will use during around 2 months after professional treatment. So the protocol is very simple. We just need to cleanse the skin, degrease the skin. Then we are using MELINE Intimate. I usually use it in several layers, from 1 to 3 layers. And after the application of the last layer, I'm waiting up to 15 minutes. That would depend on the reaction of the skin. If it goes very soft, then we are waiting for 15 minutes. If you can see some kind of irritations or some burning sensation, which is very, very rare, then you can decrease the time of exposure. And it is recommended 4 sessions with 2 weeks interval. So after the application, we wash off peeling with water and use MELINE Restore and Moist. Here you can see the protocol of treatment. So using degreasing solution, also we work bikini area, inner side of the hips. If there is some pigmentation, we can work there. Just for that area, we would need more product, not just one ampule. So everything depending on the size of the area. We ask the patient, like there should be 2 weeks interval between the laser appellation and this peeling. And if patient, for example, is shaving this area, then it shouldn't be the same day with the treatment, not to have any kind of scratches, lesions, damages. Applying up to 3 layers, then we wash it off with water. And finishing the treatment with Moist and Restore. Also recommend your patient to start to use 02 in 3 days, more or less, after the treatment, they can start to use it. And of course, hydration. So hydration, regeneration of the skin is usually like the prevention of dermal hyperpigmentation. That is why it's also a very important step for the treatment. So very easy treatment. Such kind of results you can get using both professional treatment and after that 02 Intimate for the home treatment. So it's really very nice results, and the results are lasting very long. So mostly patients really the effect have for a year, then doing the next year the same treatment, they can have results for longer. So it's really very, very nice. So these were all the professional products that you can use for like peelings or mesotherapy treatment. The other professional products, which are 01, we use for the finishing of the treatment. So that would be 01 Moist and 01 Restore. Moist is a serum, Restore is a cream. This is 250 milliliters. That is why this is the volume that you are going to use in clinic. And you have the same products which you are recommending your patients to use at home, which are already 03 Moist and Restore, but they would be 30 milliliters. So you will recommend that for your patients to use at home. So 03 Moist is a serum which is based on the hyaluronic acid and panthenol. So this is actually the product for the prevention of the transepidermal water loss, for the superficial hydration, and like for the occlusive effect. You can use Moist also, for example, patients with the oily skin, they would prefer Moist to Restore because they don't want these creamy textures. They want something very light, which will be not, that they will not sense on the, feel on their skin. And in the case of the dry skin, patients usually prefer Restore because Restore is the creamy texture. It contains aloe barbadensis, centella asiatica, arnica montana, so all the ingredients for improvement of the quality of skin, for the regeneration of the skin, also for deep penetration and regeneration of the basal membrane. And this is always the prevention of the dermal hyperpigmentation. So in clinic, you can work with both of these products, like finishing the treatment, or you choose depending on the patient's skin, depending on the type, if it's oily, if it's dry, and what effect you mostly want to obtain. Of course, we recommend patients to protect the skin. That's why we use 04 BB cream. We have two options, medium and light. These products contain sun filters protecting from UVB radiation and shortwave of UVA radiation. It also contains some ingredients that work like natural UV filters, which is Oriza sativa bran oil. And also this product will help to decrease the production of the inflammatory cytokines. That is why this is also the prevention of hyperpigmentation, not only by protecting from the sun damage, but also by the inhibition of the activity of the releasing of the pro-inflammatory interleukins. So that's the great product, very pleasant, very soft, without this effect of mask. That is why most of the patients really love it. So you have both. You have like makeup, you have sun protection, and you also have like skincare. It's even 3 in 1. I really recommend it to you. And the last product that we are going to discuss with you today, this is 05 Pigment Hole Mask. Actually, this is the product which we are going to recommend to the patient with really severe hyperpigmentation or deep hyperpigmentation. So if you can see patients with melasma for 5 years, 10 years, or this is post-inflammatory hyperpigmentation that is usually dermal, of course, you need something to maintain the result after peelings, after even home treatment. So for that, with that 05 Pigment Hole Mask, pay attention to the active ingredients. So this is actually a great product with high concentration, I would say, of active ingredients, because it's 15% of mandelic acid, 10% of azelaic acid, also tranexamic, salicylic, retinol. This is very, very active product, which is recommended to use once a week for patients at home, and the time of exposure would be from 15 minutes to 1 hour. Everything depends on the reaction of the skin, because these would be really active treatment. I usually prefer to do the first time I'm doing that mask in clinic. So patients are coming, We are applying that. I can see the reaction of the skin. Then I ask how was after the mask, was any kind of irritation, exfoliation. So after that, I can say that for you, it's better to use it once a week for 20 minutes. For the other patient, it would be once a week for 1 hour. So this is really very helpful product. And pay attention again to the active ingredients. It would be very helpful, not only in the case of hyperpigmentation. It would be also very helpful in the case of acne, because we have very potential anti-inflammatory effect here due to azelaic acid and mandelic acid. So that would also improve the situation with the acne lesions. So that was the, let's say, basic information about MELINE products. I know that there is a lot of information, but still, if you have any other any questions, please write in the chat. Now we will discuss it. The recordings of the webinars would be available on our platform. So usually by the end of the day or maybe the next day, you already can see that. Spots protocol safe. It's in Fitzpatrick 4.6. Yes, it's safe. It's in Fitzpatrick 4.6. The only thing that in Fitzpatrick 4 to 6, you don't have to obtain really, white frosting. Then do less layers, like around 1 layer, because you will really get very good results, but the difference between the color of the skin and of this depigmented area would be more significant than in the case of 1 to 3 Fitzpatrick. That's why less layers, less time of exposure, like not more than 1 hour, and everything will be fine. So don't get too much frosting as we are looking for in the case of Caucasian skin. All the video will be available on the platform, so there you can see the records of all our webinars. Where to buy products in France? Please, could you write your email, and then we will contact with you, giving you the contacts of the distributors in France. Also, you can see our email address, skincareacademy.inaesthetics.com. Then all the questions, if you have the questions about the protocols, if you have questions about diplomas, distributors, and so on, you can write there. Or if you know the contacts of your distributors in your countries, you can contact directly to them, and we are in contact with them, so we will provide you all necessary information. In Australia, please write your email. We will give you the contacts where you can buy it in Australia. If you have any other questions as for the protocols of treatment, about the products that we discussed today, also please write in the chat. We will discuss it now. Now in the chat, you can see our email address. So copy that. You can write all your questions there. The distributors that you need, the diplomas that you need, we will get in contact with you. Also, when we will finish our webinar, you also can continue writing in the chat, because we see what you are writing and what you are texting. We can see your emails, so we will answer you. So as far as I can see, we don't have any other questions about the protocols of treatment or about products. So thank you very much for your attention that you attended our webinar today. I hope you've got some really useful information that you can use in your professional treatment. And I hope to see you on our next webinars because we do it really regularly. We are explaining about all our products, about all our protocols. We are always keeping in touch with you, providing you with all the information. That's why if you have any other questions, you can contact with us directly or you can contact with your distributor. Thank you very much. Have a great day and hope to see you soon. Bye bye.